What signs and symptoms may indicate to clinicians that acute hepatitis C virus infection should be suspected? If such infection is suspected, what additional clinical and laboratory evaluations should be performed?
Unfortunately, the majority of people with acute hepatitis C infection are asymptomatic or have minimal symptoms, none that would really make them come to the doctor. So for instance, they might just feel a little bit like they have a virus or a flu-like syndrome. So because of that, most patients won't present. Now, of course, if a patient does present with symptoms consistent with acute hepatitis and they have a risk factor, then they should be tested for acute hepatitis C infection. But in reality, because most patients don't have those symptoms, you really need to go to the risk involved. So, in other words, that patients who are at high risk, meaning young injection drug users, or HIV-positive men who have sex with men with very high-risk behaviors should be regularly tested, because otherwise you'll never find it. And in terms of what additional clinical or laboratory information you need, basically, because a patient at any given time may have their liver function test high, medium, or even just barely up, you really do need multiple values to diagnose acute hepatitis C infection often. But if you ever see a patient go from hepatitis C antibody negative to positive, then that's a clear-cut case.
HCV is usually transmitted through blood-to-blood contact. The virus replicates in the hepatocytes of the liver and circulates throughout the body. Entry into hepatocytes occurs through the interaction of the viral envelope with receptors on the surface of the host cell. The virus undergoes a fusion and uncoating step, releasing positive strand viral RNA. HCV utilizes many of the host cell's proteins and molecules in order to replicate. The first step is the translation of the viral RNA genome into a polyprotein. The polyprotein is processed by both host cell and viral proteases into structural and non-structural proteins. An essential step in the replication of viral RNA is the interaction of the host cell protein cyclophilin A with the viral proteins NS5A and NS5B. This enables the functional replication complex. A replication complex is now formed to generate new viral RNA. A negative strand RNA intermediate is formed and is used as a template for the synthesis of positive strand RNA. The viral RNA is then packaged to form new HCV virons. The virons mature in the Golgi apparatus and are released from the host cell by exocytosis.
The liver is a large reddish-brown glandular organ located in the upper right portion of the abdominal cavity. It secretes bile and performs several important functions. The hepatitis C virus is a blood-borne pathogen and primarily affects the liver. The hepatitis C virus contains RNA, or ribonucleic acid, as the genetic material in its core, which is surrounded by a fatty envelope. The virus enters the body, circulates in the bloodstream, and attaches to liver cells. Once attached, the virus releases the RNA into the healthy cells. The viral RNA then replicates itself hundreds or thousands of times, making genetic material required to produce new viruses. These new viruses in turn infect other liver cells. Eventually, this process shuts down most of the normal functions of the liver cell and damages it. Symptoms of hepatitis: jaundice, mild fever, muscle and joint aches, nausea, vomiting, loss of appetite, abdominal pain. This infection may continue for years, eventually resulting in scarring of the liver tissue, called cirrhosis. Liver cancer can also develop in later stages.